Hello. I wanted to jump on here to just make a quick video talking about the overlap and distinction between OCD and body dysmorphic disorder. Body dysmorphic disorder is related to body image and eating disorders, of course, and it's commonly misunderstood as sort of a facet of OCD, and they are really linked, but there's some distinct differences. So yeah, I just want to talk about it a little bit. So, both OCD and body dysmorphic disorder can involve a high amount of checking, obviously, a high amount of obsessions and compulsions can come into play with both OCD and body dysmorphic disorder as well. But um, there are some real distinct differences in kind of the etiology of the obsession and compulsions and how we treat both. For a while, it's been kind of postulated that body dysmorphic disorder could fall under OCD, and just kind of be a subcategory of it. And it was even discussed to have that be moved to the OCD section in the DSM-5, but ultimately it was decided that research just doesn't uphold that it is under the umbrella of OCD, mainly because the techniques that work in helping folks with OCD have not been shown to help folks with body dysmorphic disorder. And that's a really important fact. That's really important to know because you definitely, and as a clinician, you want to make sure you're helping the person with the right illness, because for OCD, really the gold standard is exposure with response prevention, and that's not been shown to be effective at all for somebody with body dysmorphic disorder. In fact, it's been shown to be harmful because you're putting people through the unnecessary stress of that type of treatment without any really fruitful outcomes. And it is like it's kind of a tough form of therapy to go through. So research for body dysmorphic disorder lags behind that of OCD by probably 10 or 20 years or so. There's just not a lot of research that we have for it. But what we do know is that the approach that helps people is more of an acceptance and commitment therapy, interpersonal process-based approach where you're unearthing kind of like childhood experiences, early childhood experiences and interpersonal processes and potentially trauma that has sort of come together to create this obsessional focus on outward appearance. So that's obviously a very different therapeutic process than exposure response prevention, as you would see as the type of therapy that helps a lot of people with OCD. So I guess the main takeaway is you always want to make sure that you have a clinician, and clinicians, you always want to really try to be well versed in staying up on trainings and how to understand the differences between the two, because if you are someone who helps folks with eating disorders, you will see people with OCD and body dysmorphic disorder as well. That's not an if, it's a fact, it's a when. So you really want to understand how to help people tease out the differences between the two, and then how to provide the right form of therapy and treatment that's actually going to be helpful. So I hope this video was informative, and have a good rest of your day.